Hi everyone, my name is Pisty Kololi, healthcare consultant and I specialize in patient experience and education. You know what I do now? I equip you with the best knowledge for you to live healthy. So today we're talking about 5 vital signs to know that you are having infections. Yes, 5 vital signs of infection. One thing you need to understand is that infections are of different categories. We have the respiratory tract infections, we have the urinary tract infections, we have lungs infections and whatsoever kind of infection depending on the site where the invasion of bacteria could have occurred. But there are some general signs to show and tell you that yes, you have an infection in your body. And so one of the signs is fever in the sense that you have a raised temperature. Like your temperature normally normal human temperature ranges between like 37 degrees Celsius. So anything above, like let's say we are now having a temperature degree of 38 degrees Celsius, just know immediately that you're having fever. Fever occurs as a result of your immune system trying to fight against those foreign agents, those foreign bacteria in the body, and this results into the body system accumulating it, and this it now radiates into what is known as the high temperature, and which is categorized as fever. In medical terms, it is known as pyrexia. So, and once you have a high temperature of fever, you know that okay, this is a sign of having infections in the body, and this usually occur more frequently in children. Like whenever you see a child that has an increased temperature accompanied with other signs I'll make mention of, you should know that this child is having an infection in the body. This needs you to immediately go consult your doctor as soon as possible. Another vital signs of infection is weakness. This is what you just find out that you get so weak even after trying to take some rest. This is because your immune systems are fighting, they are working vigorously in the body, ensuring that these bacteria are fought against, like they are trying to defend themselves, and at this point in time it is using up energy, and this tends to affect your physiological states, whereby you now start feeling weak physically. Then another sign is pain and swelling. This one is very common. Like you just find out that you have a kind of swell maybe around your throat area, or it could be voice or sore throat. Sore throat is also a sign that you have an infection. Like just some substitute pains and different areas, especially those areas that are susceptible to invasion of bacteria, like maybe your private parts, your handprint areas which is swollen, could be a sign that you have infection. Then another sign is persistent cough. This is very common. You'll find out that whenever you're having infection, you experience cough, and this is because your respiratory tract is also an accessory immune system in the sense that it's trying to expel out the foreign agent, and this is when you now begin to have coughs, and then you have sore throat. You tend to now start having catarrh and all of those things. These are reactions to show that there are foreign agents in your body and your immune system is working so hard, and so you need to start taking some medications to even hasten the immune system process of fighting off those foreign agents. And then the last one is change in wound color or injury. You find out that you have a particular wound around your body, and that wound tends to not heal faster, and then in the meantime it starts oozing out some yellowish color fluid, and that yellowish color fluid in medical terms is known as pus, the release of dead bacteria from that site of infection. So once you see these kind of signs around any of your wounds, any wounds you have around your body, you tend to know that this site has been infected, like that wound has been infected, and if you leave it untreated, it could migrate from that place to other parts of the body, and when bacteria travel from the site of infection to other parts of the body, it could lead to blood poisoning. And this is the more reason why whenever you tend to see these signs, you realize you have fever, you get weak frequently, you have pains and swellings around your body, and then you have a persistent cough, and then you realize that your wounds don't heal faster, your wounds are already getting to ooze out pus, just know immediately that you need to consult your doctor as soon as possible in order to treat your infections, so as your body to get back to balance and be able to function at its best. So that'll be all for today. Don't forget to like, share and make your comments. I'll be expecting your comments in the comment section. Bye.